Right, Professor Lim, who is the chair of the COVID-19 vaccine. And our latest estimates are that since we began deploying these vaccines, they've probably averted in the region of 24 million cases of COVID-19 in the UK and averted around 112,000 deaths. So incredibly successful to date and remains so. Subcommittee of the JCVI. Thanks all for joining. But we also know that this pandemic is still active. We are not past the pandemic. We're in an active phase still. We know that this winter could quite possibly be bumpy at times. And we know that other respiratory viruses such as flu and RSV are highly likely to make their returns. So with all of that in mind, the name of the game, the mantra, if you like, is to stay on top of things. And that is why we asked JCVI to begin thinking and framing its thoughts around the booster programme back in the summer. It remains nice to see people in person rather than down the camera.
We've also now looked at the Moderna vaccine to be used as a booster, and this has also been reviewed by CHM experts who concluded that the Moderna vaccine can also be used as a safe and effective booster dose, including in a half dose, which also gives an effective boost to antibodies. The data reviewed showed that giving the booster jabs with flu vaccines at the same time is safe and does not affect an individual's immune response to either vaccine. Therefore, COVID-19 booster doses may be given at the same time as flu vaccines.
Lim, who is the chair of the COVID-19 vaccine.
We can only really measure levels of protection out to about 5 or 6 months at this time point when we're in September 2021. Therefore, we have to project what the levels of protection might be 9 or 12 months after the second dose. That's moving forward into time, into December 2021, when we're in winter.
CVI. Thanks all for joining. It remains nice to see people.
JCVI advises that adults who are more vulnerable to severe COVID-19 disease should be offered a booster vaccination in order to maintain a high level of protection through the next few months, so through this winter particularly. These people are identified as those who received their vaccinations during phase 1 of the vaccine program, and that includes the list of people that is on the slide. I'll just mention those: older adults living in residential care homes, all adults aged 50 years and over, frontline health and social care workers, those aged 16 to 49 who are in a clinical or otherwise risk group, and adult household contacts of immunosuppressed individuals.
It has been put to ministers. It is subject to ministerial decision, but if the ministerial decision is to go ahead, then it will be full speed ahead on this, but in a purposeful way rather than a rushed way. It is completely different to the situation when back in December and January at the beginning of the vaccine era, when we had very, very high levels of disease and a completely unprotected population. It's different this time, but it still needs to be purposeful, steady steps towards the goal.